lovely introduction. It was an exhaustive one, I suppose. It extended up to almost 5 minutes. Now, coming back to the subject, Dr. Nabja will be joining us with her questions from the crowd, which she'll be collecting from the backstage. Coming to the subject for the COVID-19 hygiene post-lockdown. There are a couple of things which we can ensure upon. Being a CEO and Managing Director of Voxter Bar Limited, we have taken utmost care in understanding the subject of COVID-19 as we ourselves develop COVID-19 IgG, IgM antibody rapid testing kits. We are one of the largest in India, having the manufacturing facility of almost 40,000 square feet of infrastructure. It was duly agreed with ISO 1345, GMP and all the norms. Now coming to the subject, we need to first understand what is COVID-19 viral infection all about and what are the causes of the death. As the statistics, what we can see, a person who is healthy and having a good immune response will definitely can easily counter COVID-19 infections, unless he is having a couple of more diseases in his body that will share the immune response, the antibody response, and that's where the lethal role of COVID-19 comes into action. As we must have seen, there were several viral infections earlier also. There was SARS from China, Ebola it's from Africa. Then there was MERS from the Middle East. Then there was Zika again from Latin America, from Brazil. Again there was a bird flu from China. So all these viral infections do come and do go, and they have a period of say around 6 to 8 months as per our previous exposure and experiences. So this COVID-19 too will have a life of say 8 to 10 months, unless the conspiracy theory which says that it's a lab-grown virus which may have a different structure, that could be a game changer rather. But otherwise, all these viral infections have a life of say 8 to 10 months or a year, and then we see that it gets faded away. And we hope that even for COVID-19 too, this thing will be there. Now, as far as facing the COVID-19 is concerned, we need to first understand the antigen-antibody concept. As soon as an antigen, there is an external body that enters into our system, our defense mechanism, our body starts generating antibodies, and that's what is called as a defense mechanism. So these antibodies then counter the antigen, and if the defense mechanism is strong, definitely the healthy body will survive. But if defense mechanism is weak, then if enough number of antibodies is not generated, then there are the concerns of people dying because of these infections. As far as multiple infections are concerned, it's like a country waging war with multiple countries. So if a country is facing war with just a single country, then definitely the response will be far better than compared to with multiple countries waging a war at the same time. Same thing applies to our human body also, sir. When there is an external antigen attack into the body, if the body response that is antibodies generated from the body is against only one infection, definitely they can counter it very well. And that's the reason what we have seen up till now, that in aged people where the number of infections are more, maybe because of diabetes or hypertension or cholesterol or heart disease, whatever. So the response mechanism becomes more weak, and that's where this fatality increases. Coming to the Indian population, we must have seen that our Indian population is like they are like street smart people who have gone through so many diverse conditions, vaccinated with BCG vaccines. They have consumed a lot of antimalarial tablets. So the body mechanism of an Indian is very robust. It's what we call it a street smart guy who can counter any of the threats that come upon. So that's the main reason when we see the number of deaths occurring in India as compared to the other part of the world is very very less. Of course, we are not still counting on the number of testings because number of testings done are not that high as compared to the other countries comparing our population ratio. But still, if we just see and if we see just see the death rates, it's very very less. It's almost 0.07%, which is very very less as compared to the other countries. So if we see the trend in Far East countries like Cambodia, Vietnam, Taiwan, Philippines, the developing world where the mechanism body mechanism is very very robust, the death rates are very low as compared to the developed world like US or in EU where the death rates are very high. So it all depends on the immune response system, how the body immunity is developed in due course of time in several years, how we consume the food, how we consume medicines, how we have been facing all the challenges. That's how we counter this viral infection also. Even while this recent update from CDC Atlanta, it was said that contaminated surfaces doesn't play that much of active role in spreading this viral infection. But as we can see from the practical scenario that yes, it does play some role in spreading the infection. But we don't have any conclusive evidence whether this viral is spread through touching or in coming into contact with the person or through some other means. But it is spreading only through these three means, not other than that. So we have to just ensure that all these three factors are taken care of. Now, like bacterial infections, like typhoid or any bacterial infections, there is an antibacterial medicine which can counter it. But viral infections doesn't have any medication. Even the vaccines, what we are talking of, these are just an immune boosters where even the antibodies are injected into your body just to fight with the antigen. So just like the body generating its own antibodies, and just like antibodies generated pumped into from the external source. So the basic four pillars on which one can counter this and one can take care and precautions about this viral infection is what I call it as HIPS, HIPS, which one is the hygiene, the other one is immunity build-up, third one is the protective gears, and the fourth one is the social distancing. All four we must have been reading across and through all the WhatsApp messages and Facebook and everywhere. These four are very, very crucial, even during the lockdown and even after the lockdown. So the first one, maintaining the hygiene, and that's very important as far as the sanitizations are concerned, as far as cleanliness is concerned, as far as social distancing is concerned. So these are the basic precautionary steps which we need to undertake to counter COVID and spread out. As far as possible, try to consume healthy home cooked food because that's the best for building up your immunity. Uh, Even after the lockdown is over, don't try to rush to the restaurants or other outlets and reboot your own self to the external food. In last 2 months, we have learned how to make our own food. We have learned how to survive without the external help. We have learned how to enjoy the home cooked food. So just continue with that scenario, and home cooked food is the best bet to embark upon. Again, consumption of food in a series of hours will play a very important role. Say, for example, in the morning, a healthy breakfast followed in 4 to 5 hours with the lunch, with again in the evening snacks, and again in dinner. So don't keep your stomach empty for more than 4 5 hours. That will help to build up the immune response very very strongly. So healthy and hygienic food cooked at home is really a safe bet to embark upon. Another thing, important thing is that earlier it was like sharing is caring, but now forget it. It's sharing is more of a daring. So now sharing is daring. Don't share any of your things. Don't share your glass. Don't share your cell phone. Don't share your chair. Don't share your pen. Use everything what you have been using and don't share with anyone. So that would be the utmost important as far as you contain the spread. Other thing is, we must have seen while driving on the highway that we see some slogans that "Aapka vahan 10 feet dur rakhe," means keep your vehicle 10 feet away. So same thing applies even in your real life now. The social distancing is again very very important. So just try to keep the distance and don't go very close to interact with anyone unless it is really required to do so. Another thing, go out of your house only if it's absolutely necessary. Unless if it's not important, just avoid to go out. No big gatherings, no mass gatherings. Try to avoid that. Try to avoid direct personal interactions, going into someone's cabin, going for a meeting. Try to avoid all these things. You can always discuss on phone. You can have a conference calls. You can always have Zoom chat or video conference calls or whatever. But try to avoid physical meetings rather than means opt only for the conference calls and opt only for the online way of communications. Even for business travels, if it's very very important, then only embark upon. Otherwise, try to avoid for any business travels abroad or even in India. Again, it's while starting up your factories and your offices, you need to ensure that entire pre-safety audits are done, because since last 2 months there was a lockdown, and things must have been in some corrections maybe they're required before you start the machine, or whether related to some vacuum gauge, or whether pressure pump gauge, or cleaning or oiling or greasing or whatever. So try to undertake a complete safety check, see that there are no vibrations, no leaks, no smoke, no abnormal wobblings, irregular grinding or other potential hazardous signs. Identify all those abnormalities, implement all the corrective measures, and then start the factory. Even while going for the so for starting the factory operations, don't go for a full trust in the initial run itself. Try to go with a 25% output and see how things move for at least for 2 3 days. Don't go for a 100% production output at the very first day. It's always better to go step by step, while again when you restart your operations, and always ensure that there is round the clock emergency crew available, professionals available to tackle if something abnormal happens. Also, as far as tools are concerned, try to ensure that the tools given to one workman is not shared with the other one. Try to keep another set of tools which is more safe bet. As far as concern, we have by now we must have seen that uh, WhatsApp has created a lot of vacuum in the society. While we used to visit each and every one during the festivals and all, now we just send a WhatsApp greeting and just say wish them, and that's it. So same type of vacuum still needs to be continued, rather than making unwanted social visits, which can be definitely avoided. While parking your car or your vehicle, try to see that you park your vehicle in a direct sunlight, because sunlight is the best source for ultraviolet rays, and uh, at least we ensure that the vehicle is exposed to direct sunlight for a couple of hours, and that's again a safe bet to while driving your vehicle. Don't touch your car doors directly. Maybe you can use a paper to open the door, and the rest inside is of course untouched, so you can definitely use with your own hands. That's not an issue. Avoid gatherings, social parties, and all club visits and all those things, at least at this juncture. uh, as far as social distancing and hygiene is concerned, there are several SOPs that needs to be maintained across all the industries, and I'm sure each and every industry will be coming up for such actions for the predefined SOPs. Using currencies or credit cards at the counters, where you can take a chance of getting intaking the infection. Try to do shopping online and try to make payments online through your mobile options or through your credit card online. That would be the best bet. Then, as I said earlier, lockdown has taught us so many things. Finally, I would like to also draw some points on corona positive. I call it corona positive because there are so many positive impacts also of this impact of this pandemic. Lockdown has taught us to be very independent. We now know how to cook our own food, at least the basics we can manage. We know how to ride our own vehicle. We know how to clean our house. We know how to clean our utensils. We know how to take care of our laundries. For 2 months, there were no external helps available at our premises. So continuing with that same protocol would be more advisable rather than rebooting our own self into that original structure which we used to enjoy. At least for next 4, 5 months or 6 months, we can do that. We can definitely manage that. Other thing is, it's always better to stay indoors if you are suffering from any normal sneeze or cough or fever or whatever symptoms which may look like a COVID, but it is definitely not a COVID. So don't confuse that with COVID because COVID in fact is very, very high. Like the body response is almost gone. Even the sensing powers are gone. The smelling senses are gone. And you feel very, very weak. You can't breathe normally. So don't get yourself afraid that, oh, mine, I'm having a sneeze or I'm having a cough or I'm having a fever and then it's nothing like that. But it's better to stay indoors when you have such symptoms because when you go out and when you sneeze against someone, they will not give you a pretty smile. They will not be telling you bless you, or they will be saying some very ugly comment passing on to you. So it's better you stay indoors when you have such impact, at least for your own better self and as well as for the society at large. Again, when you are in the public, try to put your hand like this and sneeze. Don't cough or don't sneeze in open because this minute droplets which is there in the atmosphere can stay there for several hours as per the latest research studies, and that is one of the major reason behind this spike in the outspread. Curtailing it would be more better for all, just not for you, but for anyone else. Then other things what we can take care of is like avoiding touching of the surfaces. Like we touch the doorknobs, we touch the handles, we touch the switches, light switches, elevator doors. So the best bet would be like I prefer keeping 5, 6 tissue papers in our pocket with a marking on the top. So when you hold that tissue in your hand, you hold it on from the point where you have some markup done, and every time you hold it from there only, and you use that tissue while touching the knob, while touching the switches, while touching the handle, while the thing is over. You can keep it for a couple of hours with you. You can put it on a table side, and then when your job is done, you just put it in the dustbin. As simple as that. So it's more better to be more precautious rather than taking chances. Again, when you go out with your cell phone, with your specs, with your office bag, with your laptop, so many things, with your shoes, everything is prone to carrying back those infections back home. It's always better to mark a Lakshman Rekha, like you mark it somewhere in your house that, okay, I will not bring anything outside from my house above this Rekha. And like that, you can put your shoes over there, you can put your bag over there. Of course, specs you need to carry, so you can take it and just wash it or something, but it's just more of a precaution. So try to sanitize it, try to clean it, and that would be the best bet to embark upon right now. Other part of the important precautions could be you should have good air ventilation in your house and in your office premises, at your workplaces, and direct sunlight is very, very important. Like there is one the big US research report on this, where they have proven that ultraviolet rays has been very, very effective in countering this COVID infection or any viral infection, in fact. In the morning, couple of those Orthodox Hindu people going on the terrace and performing this Arghya Kriya, we feel that it's an Orthodox thing, but it is very, very scientific. Of course, religion and science goes together. Science is just reinventing the religion, what I always say. So we stay in the sunlight. We offer a prayer to the sun for, say, like 5, 7 minutes. And ultimately, what we are taking is the ultraviolet rays from the sun god to us. And that is very, very effective in making us more healthy. So ultraviolet light has played a very important role in curing lot of infections, and that continues even for COVID-19 also. So good air ventilation and good sunlight, direct sunlight is very, very crucial to stay healthy. Another thing is, as far as possible, avoid using public transportation. Yesterday, there was a news that in US, people are like started buying in huge numbers of cycles and motorcycles. The middle class who doesn't have the cars, they have to opt for such private transportation. And if you have been to US, you will find that the distances from one place to other is very, very long, and only taxis and bus are operational. So to avoid that, they have ensured and they have started buying bicycles or bikes, whatever is their budget, that they can avoid these public utility services and transportation systems. Unless you are left with no choice, then you have to opt for, again, with those all the precautions of maintaining all the hygiene and social distancing. But try to avoid using this public transportations also. Another step what we can do for the hygiene post lockdown is, we are into vacations right now. Of course, half the May is now over. But once the economy opens up, don't go for or don't plan for any vacations outside. Don't go for any big expo events or public gatherings. Don't go for any big events where the mass crowd is there. At least for next 2 3 months, we need to watch the wave. We need to watch how things are, how the trend is, how things are moving on, and then only we can take a call on our next course of action. As I said, every viral infection is a new one, and humans have to understand their dynamics. Humans have to understand their pros and cons, and then only they take it over, maybe in due course of time, and then they move on. Of course, airlines have already started their own SOPs. Indian Railways have started with their own SOPs. So every industry, every offices, every segment can design their own SOPs, because again, there is no universal SOP possible. Every unit has their own infrastructural requirements, their own staffing requirements, their own way of working style. So they have to design their own SOPs and ensure that at least they take enough precautions to counter the spread of the infection. Airlines have started, like day before yesterday, they were showing at the Delhi airport. They were, when you visit the airport, you need to show your passport and the ticket to the security personnel at the gate itself and outside of the airport. Nowhere in the world you will see such thing. But in India, we are extra precautious. Even in Europe, you travel to any airport, you just go inside the airport directly. You check in, and then afterwards there is a security check. But in India, there is a security check at the gate itself. There is security, police security person check your passport and ticket. Then only they will allow you to enter into the airport. So now what they have done is, they have kept the police personnel behind some plastic or a glass shield. They have kept one camera, and the passenger needs to put that travel document, the passport or the ticket, below that scanner, and that security personnel will be looking down in that on a screen, and then he will be giving the green signal to move on. So enough number of precautionary measures are undertaken at the airports right now, like safe distance cues, wearing masks. Even the airline counters are now shielded with the glass mask. Everything needs to be printed from your home. The boarding pass, even the baggage tag are required to be printed from your home, and then it is you need to apply it on your bag and then hand it over. They are trying to avoid any hand carry baggages. Sanitization of all the common contact points is in progress every 2 3 hours. So maximum care they are trying to take so as to ensure that enough hygiene is maintained, and that's how you can control it, because you don't have a direct control. Of course, thermal cameras are a good tool, has been in use since last almost 2 decades or even more, and same has been deployed again. But ultimately, thermal cameras can give you a demarcation of the temperatures, which may not be the real indicator of COVID infection, but still they are very, very effective tool for the mass screenings, where the numbers are into thousands or into lakhs. Restaurants in Amsterdam just got opened up last week with again those enclosed shell structures with a long wooden tray to deliver and all those things. So European Union has started opening up. Even New Zealand, which is now having zero COVID infection, as what they claim, has opened up. So economies and countries worldwide are opening up. India is following also the same footsteps, is gradually opening up. They have been doing a wonderful job up till now, and they are gradually opening up. Managing this entire big crowd is a really, really big challenge. Managing a European crowd and managing an Indian crowd is completely different. You must have seen the videos. You must have seen how people react. You must have seen how people react with the medical staff, with the police personnel. They were ultimately servicing us only, but you must have seen how things are. It's not easy to manage a large crowd, as and that too the one which is not much highly literate, and that is really a big challenge. But the Indian government has maintained and managed it very well up till now. They are gradually opening up, and we feel that things would be back on track maybe in next 2 months down the line. Same is the case with European countries where they have gradually opened up. Even in Belgian port of Antwerp, they had tried to deploy they have invented some spots watch. So there is one sensor in that watch when you are when a person is wearing that watch, and if somebody is closing by nearing within the defined territory of say 3 meters or 2 meters, that watch will beep up or will like vibrate, and it will give an indication. It will be a buzzing indication to take yourself precaution. So people are coming up with all the innovative ideas to ensure that maximum care is taken, maximum precautions are taken. Even while opening up in the schools, we couple of European countries and developed countries are opening up their schools also. We need to ensure that no common facilities or no common utilities needs to be deployed, at least for now, like no common drinking water facilities, no food canteens. Children should bring their own water, their own food from home. That's the best bet to embark upon. Maybe just like what government had indicated, like 50% of the strength for the industry, the same thing can be deployed even for the schools. Like 50% of the children can come on day one, 50% of the children on day two. Normal the practice is two students sit on a bench. So likewise, if they have 50% of the strength, one bench, only one student. So again, there is a social distancing ensured. And at least to start with, one can move on with such a scenario. Again, one can keep a thermal thermometer on the gate to measure the temperatures of the children. If the child is sneezing or anything, then at least they can send it back from the gate itself. Parents themselves should be so much precautious not to send their child if they are having such symptoms. But at least we should ensure that we are not responsible for spreading it over. So that can be done. Again, in most of the modern schools, we find central ACs. We need to curtail use of central ACs. Use of home ACs or split ACs are fine, but using of central AC could be lethal as far as the circulation of the air from one room of where a person may be infected gets spread over to the other, as per a couple of research reports that we have studied up till now. So avoid use of central AC. That even applies to the offices, the same scenario. Even this 50% strength applies to the same to the office environment also, where you can deploy one cubicle and one person in one cubicle, the other cubicle is empty, and there is a third person in the third cubicle. So likewise, we can take enough precautions for at least for social distancing. Again, online coaching classes have gained wide acceptance nowadays. So same thing can be deployed even after this lockdown is eased, and same thing, online coaching can be imparted from the schools also, at least for next 2-3 months, to ensure that okay, we are taking enough precautions. The best thing what I feel is deploying of the touch-based, sensor-based utilities, not touch-based. I would say touchless. So when you deploy a sensor-based utilities, it's very simple, like sensor-based taps where you can just put your hand and the water comes out. Sensor-based soap dispenser where you put your hand, the soap comes out. Those hair dryers, you just put your hand, not hair dryer, hand dryers rather, sorry. So your hands can be dried up. So sensor-based utilities could be a very important in schools as well as in office as well as in all the public places where you don't control it. You don't need to control it.
Pastakia. Yeah. So sorry for interrupting you, but I'm getting a lot of questions, and before we run out of time, I would like to ask you these questions. Adnan is asking, how long do we follow these guidelines, and when will this end?
As I said, this impact of corona is like something new for us. Any viral infection coming is new for us, and we don't have any control. Like again, yesterday's news. There is the spike in the cases in China. Again, China we see the spike. But so there are so many reasons why there is a spike, why it is again creeping up. So we don't have any control for that. So it is only how you observe the trends. Only the trends will be the deciding factor. That okay, since last 2 3 months things are going like in this graph, and that's the way it will go. The same way what we have been having inferences on how the spread will be increased, what will be the first phase and second phase and third phase, how these were defined only through these trends. And trends will be the defining factor, the way forward, how we'll be taking actions again.
Yes, very well said, Mr. Yeah, I'll move on to the next question quickly. As you said that premises should be properly ventilated, considering season's high temperature in air-conditioned environment, is this possible by Dr. Gayendra Sahpati?
Can you repeat it? I didn't get the question clearly.
Yeah, I'll repeat it. It says, as you said that premises should be properly ventilated, considering season's high temperature in air-conditioned environment, is that possible by Dr. Sahpati?
Possible by doctor?
I'm saying this question, the question is by Dr. Sahpati.
Okay, fine. See, ultimately a closed environment, whether it's your room, whether it's an office, whether it's your private home room, ultimately ventilation is very, very important. So that you ensure that the air is circulated and nothing is growing inside, nothing is staying inside. Same thing is applied for the sunlight. You have a direct sunlight in your premises, that is very, very healthy. Air conditions are not to be presumed that they are dangerous. Don't need to keep very high temperatures. Like 27, 25 degrees, you maintain temperature, it is fine, no problem at all. But using it as a central air conditioner would be a dangerous impact rather than using a private AC cabin in your own room. That is more safer bet than the central AC environment.
Yes, yes. Like you had already mentioned, that split ACs are much better and safer than centralized ACs. Yes. The next question that Dr. Sahpati is asking you is, what do you think will opening up the services lead to a sudden rise in COVID-19 infections?
Like there are two sides of the same coin. If we don't open up, we have billions of losses up till now. Even the basic utility items like what you take, the food and all those things, they will not last for long. So since last 2 months, you are already consuming everything from the departmental stores. If you now order something from the departmental store, they will say that no, everything is empty. We don't have this, we don't have that, we don't have this. So either you die because of COVID-19 or you die because of there is no economy opening up. You must have seen how riots are now boiling up, how the migrant peoples are reacting. So there is no choice left. We tried to curtail it through lockdowns for a good period of time, though the government didn't get the right response from the public at large due to, of course, its own limitations of the public itself. But then at certain point of time, with all the precautions, we need to open up. There is no choice.
Yeah.
And that's what other countries are doing. Even we are not the developed country, we are only a developing country. But other developed countries have deployed the same tools. They are gradually opening up. They don't have a choice. Even the countries like Germany and Japan have said that now we are in recession. So we will be sailing in the same boat if we don't open up at this juncture.
Yeah. Let me move on to the next question quickly. We are running out of time, but I would like to take as much as possible. Sandeep is asking, do we need to sanitize items at home when we buy from market? If yes, how?
See, sanitizing, people has been using sanitizers. What is the impact of that sanitizer on the product what you have applied is really a question mark as per my perceptions. But what I usually practice it, that whatever I purchase it, normally I don't purchase any fruits or green vegetables. I don't purchase it. For last 2 months, we have not procured any green vegetables, nor not any fruits. Whatever is procured from outside, I put it in a separate room. And for 4 or 5 days, I just don't touch it. This is a provisional item that needs to be used in next week. So this practice, I was using it. Now, if you apply a sanitizer on each and everything, again, sanitizers, how much impact it is going to generate, we don't know. But still, it's like it's ensuring our own self that okay, fine, we have taken enough precautions. But ultimately, what I said in my earlier session, it's always better to keep a separate room for all these things. Whatever is coming from outside, you put it out for at least for 72 hours, which is a normal guideline that for 72 hours, COVID can sustain. Some say it can last even for 5 days. So I put it as 1 week. So 1 week, I don't think after 1 week it will be there. So what I do is for whatever I need something, I put it in a separate room and use it after 1 week. That is the best bet to embark upon. No sanitizer, because in last 2 months, I have never used a single sanitizer.
Yeah. Dr. Apeksha is asking, how can clinicians take precautions daily seeing patients, as certain cases we must touch the patient in certain areas where it's hurting, for example, while they have to examine? And this will be my last question because we are really, really running late.
No issues. See, PPE kits are used by the doctors, but same, you can't wear it all the time. So the best thing is covering your entire body needs to be covered with your clothes. No, not the PPE kit I'm talking of, just your clothes. Wearing the gloves and wearing the face mask are the best thing to ensure that you are not coming into direct contact with the infected person. But as far as possible, first thing what you need to check while examining a patient is that he's not having those symptoms which are in alignment with this COVID, which normally as a doctor, in so many years of practice, you easily get a feel. Nowadays, the old GP is what I'm talking of. They don't even ask for a lab report. Just by the symptoms from the patient, what they talk, they could easily judge that, okay, this guy is suffering from this. So on the same lines, first thing is you need to first identify that whether the patient is really having some symptoms, so then don't take much chances. And if the patient is not having such symptoms, then just ensure for the basic hygienes. And then you can check the patient. When the patient is gone, just remove of the gloves, your face mask, and use a fresh one, which is always advisable.
Yeah, very well said. This is like one of the things that healthcare workers throughout the world are facing right now by taking adequate measures, having access to PPEs, sanitizers, gowns, and masks. They are able to help as many patients as possible. Thank you so much, Mr. Pastakia, for this invigorating and insightful session. It was really, really reassuring. The message that you put across that for the next couple of months, we have to be cautiously watchful. We have to move back into the civilization, but we have to take baby steps. Thank you so much for your time, sir. It was such an honor and a pleasure. Thank you.
Thank you very much. Thanks a lot. Bye-bye.